There's a lot that goes into jaw surgery. I'm sure you've thought about it, or maybe you've had some reservations. The normal way that we go about this is usually you come from an orthodontist, so I'm assuming you've already met with your orthodontist. They told you you've needed jaw surgery, and so now you're here. That's not always the case. Sometimes you skip that step, but it is important to have an orthodontist involved in this process. We can get your jaws aligned, but the orthodontist is an integral part in this team to be able to get your teeth together. So we always recommend having an orthodontist involved. Now, the period of orthodontics that is involved prior to surgery varies depending on your situation. It could go from 3 months, it could go all the way up to 18 months, getting your teeth ready and prepared for jaw surgery. And so your orthodontist will be a good resource on telling you how long that would take. They usually have a pretty good idea about how long you'll be in braces prior to surgery. Now, you'll be in braces through surgery as well, and even after, as they do some fine tuning and some detail work, getting the teeth to mesh after we align the jaws. Like I said before, the orthodontist is a big part in this procedure, and so as your orthodontist is going through the process and getting you prepared for surgery, he's leveling and aligning the teeth, getting them ready for the future bite. Sometimes the bite actually looks a little bit worse prior to surgery. They're taking out these compensations that the teeth have gone through a natural process of trying to find chewing partners. And so by taking those compensations out, sometimes the overbite looks worse, or the overjet looks worse, or vice versa. The one thing that we always start with this process is we want to know what you want to see fixed. What is bothering you? Is it a cosmetic concern? Is it a functional concern? Not being able to chew food? Is it a breathing concern? And so we want to know what is motivating you to go through this procedure so that we can make sure to hit those goals for you. So that's usually the base where we start. Let's find out what you want to see fixed, and let's move from there. As the orthodontist is getting closer and closer to surgery, we want you to think about a date when you want to do this. Not necessarily a specific date, but a time in your life, because it's going to be a 2-week recovery. Younger patients that are in school still, the most common time for this is during the summer or over a Christmas break. We do a lot of these procedures during that time, and so think about when this is going to fit into your life. Adults may not necessarily have a school to work around, but work, and so when you can find a time to take 2 weeks off and recover from this procedure is going to be the best time to do it for you. And so as we are approaching that time in the year when you want to do surgery, we like to get a buffer of about 2 to 3 weeks, 2 to 3 months prior to this date, so we can start the insurance pre-authorization. We want to make sure that we get all the information to your insurance, we get the green light from them. Sometimes that takes a while. We get denials from insurance companies all the time where we have to go through an appeal process, and the back and forth can take a little bit of time. And so I don't want to see you get into a situation where we come December 1st and you're ready for surgery, you want to do it by the end of the year, and we just can't get it done. Either the schedule's booked up, or we just can't communicate back and forth with the insurance fast enough to make it happen during that target time. And so 2 to 3 months prior to this surgery date is a good thing, so we can get the ducks in a row from an insurance perspective. Once we get the green light from them, we pick out an OR date. The OR, we use either Ogden Regional, McKay-Dee, or the IHC facility in Layton. Those are the hospitals where we're doing these procedures out of when we're dealing with insurance. Now, if we end up having issues with insurance, either denial or you don't have insurance, sometimes we can do these procedures in the office as well. We can talk about that if that is your situation. But once we get all that lined up, we got the OR date picked out and fixed. We have you come back and see us for a final surgery workup, usually 2 to 3 weeks prior. We get all the information that we need, CT scans of your teeth, photos, measurements. With all that information, we upload it into a computer program. We plan your jaw. surgery on a computer program on the desktop in 3 dimensions. It's a great program, and we are able to do things more accurately, more predictably that way. So we get the surgery planned. It comes time to go to the hospital. The procedure is done in the operating room under a general anesthetic. You're totally asleep. Upper and lower jaw surgery combined usually is about 4 to 5 hours. Single jaw surgery, usually about half of that time. You spend the night in the hospital. We want you to recover in the hospital under the care of the nurses, making sure you're hydrated. Nausea is probably the most common issue that you deal with overnight, and so we want to make sure that we have your nausea under control. We're giving you fluids. We want to make sure that you're able to function at home, in a comfortable manner before we let you go from the hospital. And so usually it's less than a 24-hour stay in the hospital. We usually discharge you the next day. You come to the office. We do some radiographs, and make sure everything looks good. And then we let you go home for the recovery, during that week. Now, like I said, the recovery period is 2 weeks. That first week is not pleasant. It's probably better than you would think, but it's still, you got big chipmunk cheeks and big swollen lips, and we put you on a no-chew diet during that time, so that's no fun. And we give you some recipes. We have a folder that we'll give you that has some blended food recipes and things, resources that you can use during that time. But that first week is you're getting used to it. Used to new jaw and the recovery from the surgery itself. So that first week is no fun. By the end of 2 weeks, though, you're feeling better than we want you to, because like I said, we do put you on some restrictions. We have you on a no-chew diet for 4 weeks after surgery, soft chew diet for 2 weeks after that. At 6 weeks, we typically let you chew whatever you want as long as it's not painful, okay? I also have you on no strenuous activity during that time, no lifting greater than 20-25 pounds. We want your body to focus all of its energy on healing during that time and nutrition. And so, the no-chew diet is something that you're gonna have to get accustomed to, and eating frequently, 5-6 times a day. No contact sports for 3 months, and so for some people, you have to kind of plan that surgery around that as well, as kids are in school and competitive sports and whatnot. And so I say contact sports, but it's really anything that you may get hit in the face. We don't want you to undo the surgery that you just went through by sustaining trauma to the area. Hopefully that was informative.